It's the WMAY Business Spotlight with SIU Center for Family Medicine here on WMAY. I'm Greg Bishop, and we're joined by Dr. Christopher Smyre from SIU Center for Family Medicine. And Doctor, we're talking about something that's near and dear to my heart because I'm a male, and we're talking about men's health. And let's just get right into it here because I think it's something that men sometimes they want to be independent. They want to not necessarily have to take advice from people, but doctors are there to give them advice and to give them the knowledge they need to live a better life. So, um, what are some of those major health concerns that men at certain ages need to start thinking about?
Yeah, I think the reality is most times we see men after there's been a scare or after their wife has told them or their significant partner has told them, you're going to see a doctor and has made the appointment for them. I think the benefits of seeing a doctor and understanding that a lot of issues that arise can be prevented. And if caught early, can actually be easily managed, cheaper cost for you and overall improving your quality of life. And so I think men to see a doctor at least once a year. And I think there's a certain screening tests that are really important to maximize one's health. Typically around like colon cancer, which we start screening everyone at the age of 50. Or if you had a first degree relative, meaning like a brother, sister, or parent who had colon cancer 10 years prior to that, if that would start them under the age of 50.
And when it comes to men's health, a good sign might be you're not able to tick off as much of that honeydew list as maybe your significant other has lined up for you because you're just not having the same types of energy levels. What kinds of other things should people be watching out for just to ensure that they know certain signs that they need to get some medical help just to live a higher quality of life?
Yeah, I think with the pandemic and the requirement for wearing masks now being lifted under certain restrictions, especially for those vaccinated, a clear sign for me that maybe we need to take a closer look is that if you're wearing your mask and it makes it where you feel harder, sort of a breath, hard to do your normal activities with that mask on, then that may be some maybe an indication that you're not able to function at 100% capacity. And so there are things we can look at trying to optimize within your health, things we can evaluate to make sure you're in your healthiest state.
This is the WMAY Business Spotlight, talking with SIU Center for Family Medicine, Dr. Christopher Smyre. I'm Greg Bishop on WMAY. How can men improve their overall health? You always hear about balanced diet and exercise. Is that just the key that people really need to hit hard on, or what are some other things that they need to do to live a healthier life?
I definitely think we have to talk about weight and obesity and things that we can do to control our weight by eating the right types of food, exercising, being fit. But I think another really important thing that often gets overlooked, especially for men, is mental health and thinking about what are the stressors that you have in your life and do you have healthy ways of coping with those stressors. A long, hard day of work, coming home, wanting to have one beer or two beers is okay. But if you're getting 3 to 4 beers at a time, your liver can't fully process and break down the alcohol safely. And so making sure that men have healthy ways of managing the natural stressors that they're having in their day-to-day lives is something that's really important. And that can be managed with medication if really necessary. Also, having a therapist and doing other activities like exercise or yoga can really help with maximizing one's wellness.
I myself know the benefits of good, healthy diet, good exercise routine. But I'll freely admit, doctor, there are times in my day where, 13, 14 hours of a workday goes by and I'm just exhausted. How important is it that people be selfish with their time to focus on getting that 30 minutes of exercise and maybe doing an extra bit of food prep to get away from some of the high cholesterol foods that they may just be quick access. Talk about the importance of just devoting that time to ensure that you're getting the most bang for your buck when it comes to your life.
Yeah, I mean, the one thing is your time is the most valuable because you don't get that back. And I think there are definitely ways that we can maximize our health and really extend that time and make sure we have a high quality with it by exercising, by looking at sort of meal prepping. One of the things I found helpful is sort of having a dedicated time to just map out all the food for the week, have one day of cooking and then just pulling things from the refrigerator, because when you're starving or hungry after a long day of work, you're not going to be making the most health conscious decisions at that moment. And so being proactive and sort of thinking about and planning those things out makes it so that you don't have to think about it in the moment and during the week.
It is the WMAY Business Spotlights with SIU Center for Family Medicine. We're talking with Dr. Christopher Smyre on the WMAY Morning News Feed. I'm Greg Bishop. And Doctor, we talked briefly about it earlier, but the doctor visits. How often should men schedule their time to get in front of a doctor, just for the regular routine checkups?
I would say at least once a year. Depending on your health condition, it may need to be a little bit more frequently, just with following up to make sure things are progressing in the right direction and getting better, or conditions aren't getting worse. I think the reality is a lot of times people associate, when I see the doctor, they're going to give me bad news. But if you're checking on a regular basis, often those conversations can be more of things are going great. Let's modify and tweak this here or there just to keep things in a good place, so that you're not getting the scare, or you're not finding out that your health has deteriorated significantly. And now we have to do a lot of interventions, a lot of costly things to try to recover and get you better.
Definitely important to consider. Make those decisions to see the doctor at least once a year, listen to their advice. And when your significant other says, get to this doctor's appointment, you should probably follow through and go to that doctor's appointment. Dr. Christopher Smyre, thank you so much for taking time with us. If people have more questions for SIU Center for Family Medicine, how can they get a hold of you guys?
So they can go online, siumed.edu, or they can call and make an appointment. The number is 217-545-8000.
Dr. Christopher Smyre here on the WMAY Business Spotlight with SIU Center for Family Medicine. Thank you so much for taking time, and best health to you and yours.
Thank you.